Good day. My name is Joe Casna. I'm a candidate to continue my service on our Board of Health. Our Board of Health is an elected board that implements programs, enacts policies to protect public health, and promotes a healthy community. We serve as the local arm of both the DEP and the Massachusetts Department of Public Health. We perform a variety of responsibilities, which include food establishment inspections, plan reviews, inspections of summer camps and public swimming pools, tanning establishments, body art facilities, and septic systems. We also investigate complaints, conduct housing inspections, and supervise visiting nurses who conduct health, blood pressure, and flu clinics. Perhaps the most turbulent time in recent memory, the COVID-19 pandemic, has brought local boards of health and health departments to the forefront in our communities and neighboring communities. It's become imperative that the local boards of health do everything in their power to protect the health of our population. In response to the pandemic, over the past year or so, our Board of Health was able to take a number of actions to help prevent the spread of COVID-19 in our community. Some of these measures included executing over 24 vaccination and booster clinics for adults and children. That was quite the feat. We're one of the very few boards of health who actually were able to do this. This resulted in our being able to vaccinate over 2,700 residents and children, including both homebound and first responders. That was quite a feat. And yes, during that time, the most difficult of times, we did mandate a mask mandate in town-owned buildings during the height of everything as a safety measure. And we also continued contact tracing through the pandemic through a statewide monitoring system called MAVEN. This past November, the Board of Health hired their first public health nurse. Her name was Leanne McGinnis. Leanne was the leader of our vaccination clinics. She put together a team of volunteers that accomplished the feats that I just spoke of a moment ago. We also this year have brought in a new administrative assistant, Miss Elise Desmond, and we are currently in the process of hiring a new health agent. At the present time, our consultant, Mr. Arthur Boyle, who is also our former health agent, is conducting many of our inspections. Our department this year issued over 250 permits, ranging from restaurants, body arts, and septic systems. The department also responded to and dealt with over 50 complaints, many different varieties, including trash, COVID, septic odors, rodents, etc. The board has worked closely with businesses in our community to make sure that they had any and all the resources needed to continue successfully. Also, from 2021, we updated our tobacco regulations. And yes, we continued to conduct our compliance checks to make sure that compliance with Massachusetts and local regulations regarding the sale, vending, and distribution of tobacco products and prohibition of synthetic drugs was being adhered to. Where we are now, aside from the fact that we are interviewing currently for a new health agent, I'd like to tell you that the Kingston Board of Health is the leader and has been awarded a $1 million grant to increase public health services in a region consisting of 5 communities. Kingston is the host community of this grant. At the current time, we are putting together the organizational committee that's going to run this. There'll be a representative from each one of the communities involved. And just to tell you, the communities involved are Kingston, Plymouth, Wareham, Plimpton, and Carver. We are also, we are the lead community in this. And we think you're going to see some benefits coming out of that. So I'm on the ballot to continue in your service. I look forward to your continued support, and I appreciate the support that you've given me in the past. I take this opportunity to thank you. Thank you.